Hi there, everyone. Teresa Dufour here, and welcome to this edition of Live at Work Play, sponsored by Wheeler Health. We're chatting with Dr. Sabrina Trokey, President and CEO of Wheeler Health. Now, Doctor, I think a lot of people hear Wheeler Health and they think mental health, but right now your priorities are shifting to a whole person healthcare. Why is that?
We started to see that a number of our patients were not having equal access to primary care services. As we inquired about primary care, what we were finding was that the majority of our patients were accessing primary care in the emergency rooms, which meant they weren't getting the screenings and wellness checks that they needed to. So we transformed our system of care to meet that need.
Doctor, what has the feedback been, and why does this make such a big difference to your patients?
Patients now can come to one location where they see their primary care provider, psychiatrist, behavioral health nutritionist, chiropractic. We have lab services on site. We have pharmacy on site. So it's well-coordinated care.
Fantastic. And I know patients are always concerned about accessibility and the cost of health care. How do you address that?
With accessibility, we offer same-day open access. And as a community health center, we do not turn any patient away for their inability to pay.
Wow. So just run me through the process. Someone needs to see a doctor. What can they do?
Walk into any one of our 5 community health centers in Hartford, New Britain, Bristol, Plainville, and Waterbury, and you will be greeted by staff that will begin to work with you in providing care.
Sure. What a resource. Thank you so much for all the information. And if you are in need of any sort of health services or just want to learn more, you could log on to wheelerhealth.org. And as always, thanks so much for joining us for this edition of Live, Work, Play.